Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, DrAndyRoark. Guys, I am here with Dr. Beth Venit, the Chief Veterinary Officer for the American Association of Veterinary State Boards. And we're talking about some rules, guys. We are talking about the standard of care. We are talking about board complaints. Mostly, we are talking about Beth's new article where she talks about practicing a spectrum of care, right? Providing a number of different options for the pet owners. And also making sure that is above board, that is legally protected, that we're not going to have board complaints, problems like that. And so she really talks about that gray zone where it's not always possible to do the gold standard of care, the most technically advanced approach to medicine. And we still have obligations that we have to meet, and we do not want to practice less than the minimum standard of care. And so her article is really about navigating that and looking at that, and that's what we talk a lot about. So I think it's a lovely article to have, because I think a lot of us have always wished that something was written down to help us get our head around, is this good enough? We're not able to do the gold standard, but am I doing right by this pet? Am I exposing myself to risk? What does this look like? Am I doing the things that I'm supposed to be? Am I covering my bases while I try to help this pet and this client? And so anyway, that's what this episode is all about. Guys, I hope you'll enjoy it. Let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. DrAndyRoark.
Welcome to the podcast, Dr. Beth Venit. How are you, my friend?
I'm doing well. How are you?
Man, I'm so great. I just love having you on here. It's so great whenever we get to talk. I am so glad that we have become friends over the last couple of years. I feel like there are these sort of interesting sort of regulatory things in medicine that come up, and you're the person that I go to. And I feel so grateful for our friendship. So I'll start off and thank you for that. For those who don't know you, you are the Chief Veterinary Officer for the American Association of Veterinary State Boards, or AAVSB. And so you weighed in a lot as far as the regulatory parts of our profession. You are the go-to source for what board complaints entail and what veterinarians need to do to get out of trouble. And so I paid extra attention when I saw your new article come up in JAVMA, the Journal of the American Veterinary Medical Association. And it is called Informed Consent Plays an Important Role When Practicing Veterinary Medicine Along the Spectrum of Care. Now, JAVMA is known for super sexy titles. And I think that this one is exemplary of the type of titles that they slap on their stuff. But this is interesting to me because I think spectrum of care or contextualized care is really important. I think this is a really important place for our profession to go in terms of keeping care affordable. I think we need to be able to tailor the medicine that we are doing to the client and what their resources are and what their abilities are and kind of what their beliefs are and what they trust and see value in. And at the same time, I'm wary of throwing the baby out with the bathwater. I don't want us to normalize not working up cases. I don't want us to normalize not doing your job or just always taking the easy route in the exam room and going, it's not a big deal. Don't worry about it. I want us to continue to do good work and also to be able to work with the clients to try to keep care affordable. And so anyway, I'm looking at this and I'm looking at how you sort of lay these things out. And I really love the way that you discuss about what is acceptable in terms of spectrum of care and where are the things where you can say, this is a spectrum of care, but you're actually not meeting the minimum standards of practice here. And that's not okay. I know there's a lot of people who are excited to have something that's out that talks about, yes, the gold standard is not the only acceptable standard, and actually put some sort of guardrails around what that looks like. And so anyway, I wanted to dig into this with you and sort of talk about spectrum of care and what it means to practice across that spectrum as opposed to just the gold standard. So let me sort of stop talking here and sort of say to you, Beth, what was your intention when you sort of started down this path and sort of laid out this article?
Well, thank you for all the kind words first, Andy. This is a great article to write. I basically wrote this to my younger self. So when I practiced for 12 years and young Beth really focused on the gold standard, I was one of those people that left veterinary school like, we can only practice gold standard. Mm-hmm. If we don't practice gold standard, we are risking our license. I remember one day I recommended a urine culture to a UTI that this is like the fifth time that the patient had a UTI. And I said, you really need to do a culture. And the client said no. And I literally thought the board was going to come after me for my license because I was that scared. So I wrote this article like thinking, what did I need? What should I have heard when
Yeah.
I was practicing to give me permission to work a little bit more with the client and meet them where they are and what they need? Because it isn't just about finances. There's so many other factors that need to be taken into account. For us, we have a cat who has declined medical care. He has told us he does not want to ever be a patient. So even if we want to do treatment, if the vet said we're going to have to do an echo and an ultrasound and hospitalization, our decision would have to be, this is not what our cat wants. So it's not always about finances, it's also about abilities of the client or how would the patient tolerate it. So there's so many different factors that go into account. But from my perspective now, sitting here as Chief Veterinary Officer, in my role, I listen to a lot of board meetings, regulatory board meetings, which I find fascinating, but
good. That's good for you. Yeah.
Nobody else does. But in that, some boards do talk about disciplinary cases. And I noticed that more often than not, a lot of these cases came up because the client did not feel like they had the agency to make decisions, or that they were not fully informed about what to expect or what their choices were, both on the high side and the low side of the spectrum of care, or that the veterinarian made assumptions about what the client would want. So this article really addresses a lot of those common themes that I hear. And the bottom line is, yes, gold standard care, or the most technically advanced care, most advanced care, that is part of your recommendations. And you're right, it absolutely should always be part of a recommendation, no matter who we're talking to. But at the other side, you also have to talk about the other options that they have open to them. And that kind of discussion is part of the trust building process between you and a client. The client needs to hear, like, I care about what is important to you. So let's figure out what that is, and then we can find a path forward.
Is there a scenario where veterinarians end up in more trouble by only recommending sort of the gold standard, the most aggressive path for care, and not offering more conservative paths? Because I've always heard if you just offer the gold standard of care, not as long as you offer the gold standard of care, you're totally fine. And what I'm kind of hearing from you is, well, if there's some perfectly acceptable more conservative options and maybe you aren't talking about them, that could be a problem for you as well. Is that true?
Yeah, so let's think about how a complaint would end up in front of the regulatory board.
Okay.
So a complaint ends up, as we talked about in a previous podcast, a complaint starts, or a disciplinary action starts when there is a complaint, and the complaint can arise from the client as a member of the public. Mm-hmm. So if the client is unhappy about their treatment or how things went, then they may file a complaint. That unhappiness can come from sticker shock or buyer's remorse, just as much as it can come from them, thinking that their pet didn't get the proper care. So those complaints can come for many different reasons. I personally wonder if a lot of complaints arise from the client thinking that they lacked agency or they weren't enough in the decision-making process. And a lot of complaints will say, I don't want another person to go through what I went through. If you embody the idea of spectrum of care or contextualized care and start with what the client wants, give them all of their options, make sure that they're fully informed, you are actually less likely to get a complaint in front of the board.
Yeah. So that makes sense. I had not considered the idea that buyer's remorse would end up in a board complaint. And when you say it, it seems obvious. It was just not something that I had really clocked. And so it's interesting that you've seen a good number of that. I want to talk a little bit about minimum standard of care, because This is something in the article that I'd never seen laid down. I knew that, I know what gold standard is, and I don't want to do a bad job, and I don't want to be negligent. But I had never really gotten my hands around what is the bottom, Andy, that's acceptable. And I also thought it was really interesting in this article, you talk about there are scenarios where the veterinarian offers passive therapy that are not good enough. And if you endorse or you even carry out, therapies that don't meet the minimum standard of care, it sounds like even if you document those things, that's saying the client want this, but there are some things we should just flat out refuse to do because it doesn't meet the minimum standard. Can you talk to me a little bit about the minimum standard and sort of what it means to meet that? And then what happens if I don't meet it?
Yeah. So the minimum standard of care is a difficult concept to understand. I think we as veterinarians understand gold standard a little bit better because we are used to being taught that. Nobody really says, okay, this is the minimum. We're taught these are algorithms, these are all the diagnostics that you can do. Something that would be below the minimum. So first of all, minimum standard of care is actually defined in some practice acts. And it can be, and I actually have this written down so I make sure I'm right, what a competent average veterinarian could reasonably deliver in a same or similar circumstance. So it's just basically saying, are you reasonable? Are you average? Would somebody else do the exact same thing or a similar thing if they saw a similar case? One veterinary lawyer that I talked to said, standard of care is, if it ended up on social media, would you be embarrassed?
Yeah, that's standard of care.
You know,
Nice.
if the answer is yes, that is below the standard of care. To use an extreme example, a dog comes in with what you suspect is a ruptured gallbladder mucocele.
Okay.
Right? What is the only way to treat a ruptured gallbladder mucocele?
So we're going to surgery, right? I mean,
Right.
that's it.
I mean, that is the only way to reasonably address or to reasonably expect a good outcome from that. Below standard of care would be saying, have some Pepsid and everything. That's just an example. The standard of care is determined by the board on a case-by-case basis in response to a complaint. So again, a complaint has to occur first for the board to take a look at whether or not the standard of care is met.
Right. It's interesting because the client plays such a big part in this, right?
Yeah.
Like you can, if the client has a problem with it, then becomes, this can become a discussion about whether or not this minimum standard was met or not. And it's always interesting when we start to kind of butt heads with the clients about sort of what is acceptable or what is not. You've talked a bit about this research recently. I know you had mentioned before we started recording the number of people who have sort of come up to you to sort of thank you for sort of putting these sorts of things out. Do you feel like there was a lot of concern about sort of minimum standard of care? I understand the point of the definition. It's really hard to say, what would an average veterinarian with average resources do in this situation? I go, that's not written down anywhere, Beth. I can't Google that. I really don't know. And so I think that causes people a lot of anxiety. So I don't know, is that sort of a common sort of pushback that you hear, or do you hear complaints or concerns about that?
Yeah, I would say more concerns or confusion rather than complaints, but maybe they're complaints and I just interpret it differently. And going back to your other question, people are concerned about what to do if the client does want to do a path forward that they would consider below that the veterinarian would consider below the minimum care. The regulators that I've talked with and most people in my profession that I've talked with or my line of work all agree that it aligns with the veterinarian's oath of ethics not to approve a course forward that is below the minimum standard of care.
Yeah.
So veterinarians are obligated to go with what the client wants, but they also are obligated to be above the standard of care no matter what.
Yeah.
So I think that's a lot of the concerns that I hear from people is, what do I do if the client doesn't want to do it or whatever? And that's where I bring into the idea of, and I hate using the word AMA, the against medical advice. Again, young Beth was very happy to go in and slam it down and be like, sign it. But I didn't actually do it. I did it in a much nicer way. But I don't want people to use this concern to weaponize the against medical advice form. It can actually be a really useful way to educate the owner and to have them come back if they've thought about it more or they found other resources or another solution. So first of all, the form and other paperwork around it serves a very useful tool to protect the veterinarian.
Okay.
So if a complaint ever comes in front of the board, the veterinarian can provide this paperwork to say, I advised the client that this was against my recommendations. I told them what I do recommend. They declined all of my recommendations and they left without treatment. Or I suggested a second opinion so that they could verify that my recommendations were good. Or, I said, come on back and do X, Y, or Z. So what a great way to use the form to do is to just list out very quickly. It doesn't have to be like War and Peace, but just list out your recommendations, like x-rays to look for X, Y, or Z, or blood work to look for X, Y, or Z, or I think your pet will not survive unless they have emergency surgery. And then these are the places where I recommend that you go for surgery. And then give it to them and say, listen, I know this is a very difficult situation, difficult conversation. I know you must be going through a lot right now. I'm still on your side, so please come back and ask questions, or please let me know if you want to move forward with any care.
Do you have to ask them to sign this? I'm being vulnerable here and say,
Yeah.
I hate the idea of being like, I don't agree with you, and you don't like my recommendations, and now I need you to sign this thing. I am open to saying, I love the way you just put it up. Look, here are my recommendations. I've written them down for you. These are the things that I would do. I'm fine with that. The whole act of I need you to sign this feels so confrontational to me. I don't mean to be a wimp, but I really hate it, Beth. Do I have to do that?
Listen, the form in the signing is to protect you. So do what you need to do to protect you if this ever comes up. What you could do is have it and just with the bullet points and have a little line next to it and just say, we're going to talk about each one of these recommendations, and I would like you to just initial just to show that you've understood that what the recommendation is. And if you don't understand the recommendation, don't initial it, and let's talk about it a little bit more. Mm-hmm. Use that as kind of a tool for them to like signify, yes, heard, received, I'm still declining, use it as a tool.
When veterinaries start to look at sort of spectrum care, this is something I'm really interested in is training the next generation of doctors. I think that, and this is sort of my just sort of view on the profession right now, but I think in the past, veterinarians were trained towards the gold standard of care. And then we all kind of shook out. Maybe most of us were not actually able to practice necessarily the gold standard that we were taught. For example, I didn't have an MRI machine in my clinic, but you know what I mean? Like I don't have a CT scan. I don't have an MRI machine.
Don't.
I just didn't, no. I went with a cheap one and then it didn't last. And you just wear them out. But, so there's things like that. And we all kind of sorted out from that. I feel like the gold standard of care is climbing higher and higher, and we're getting more and more technology, and there's more and more things we're able to do, which is great. But I feel like this space between the gold standard, the most technically advanced treatments, and what I would consider to be an acceptable approach to a medical issue, that space is getting larger and larger. And so what are your thoughts on training doctors into that space? Like, how do people know that they're sort of in bounds? And I was just sort of talking to someone recently on this. Unfortunately, the way that our medical sort of research is being supported, especially today, a lot of our research it's funded by pharmaceutical companies, right? Or companies that have medical technologies that they want to get them approved. And so the new things, they get research funding and they get support and they get published. I don't know a lot of people who are shelling out the money to determine that more conservative approaches work just fine, that this middle of the road approach, these are the outcomes that we get. There are some of those things that are coming out. I think that they're really important, but I just don't see a lot of that. And so I see all of the researches around sort of the gold standard. How do I teach young doctors? How do I know myself? Like, what does education of a spectrum of care look like when I want to make sure that the doctors are covered?
Yeah, that's a really interesting question, Andy. So I'm not an education expert, but I do hang out with them. And I know that a lot of the veterinary schools are making, or some of the veterinary schools are making great progress towards that. Ohio State, and I know Davis, amongst others, Tufts. So there is a growing conversation about how do we address this with students. I think, unfortunately, a lot of this is just experience. And that kind of is why mentorship for recent grads is so important. But there are also a lot of studies out there that, in addition to raising the standard, the high end of what gold standard could be, they're also giving suggestions for what lower alternative treatment plans could lead to acceptable results. So there's all the studies about maybe the sun can set on a pyometra if you fully inform the client, support the dog as needed. So it is hard that you're right. There is so much more evidence out there for students, but the students that I've talked to that are in programs that address community care or spectrum of care, contextualized care, I think that they are a lot more confident about meeting these needs than certainly I was when I graduated. So in the dark ages.
I see that as well. It's one of the many things that makes me sort of optimistic about the future. I love it.
Yeah.
Beth, if thinking about this article, if you could send one message back in time to young Dr. Beth Venit, what would your message be to her?
Aside from chill out, man.
Aside from chill out. That might be the message.
Well, it may be the gold standard you should be trying to achieve is giving the client every thing that they need to make the decision that works best for them.
That's fantastic. I think that sums it up beautifully. Dr. Beth Venit, thank you so much for being here. Where can people find you online?
So I am on LinkedIn, so you can look at me there. And there you could also go to contact us at aavsb.org. And if there's a question, then my staff will make sure I get it.
That sounds great. Thanks so much for being here, Beth. Guys, thanks for tuning in, everybody. Take care of yourselves, gang. Be well.
Thank you.
And that's what I got. Guys, thanks for being here. Thanks to Beth for being here. If you enjoyed the podcast, please share it with your friends. Hit the like and subscribe buttons. Do all the things that help our little podcast be vibrant and continue on. So anyway, take care of yourselves, everybody. I'll talk to you later. Bye.